This video presentation will introduce you to MyVision Express EHR. Our mission is to provide the best eye care business management software solutions and services that help to constantly improve and optimize your workflow, and therefore your success. We have always listened to the leading industry experts, our customers, to ensure that we deliver flexible, cost-effective, and intuitive software solutions that will lead your business into the 21st century. We provide you with the tools and need to meet your business challenges today as well as tomorrow. Your success is our success. MyVision Express was built from the ground up as eye care specific software, and our staff includes experienced eye care professionals that help us design the software as well as train and support our customers. These customers range from independent practitioners to some of the top 50 optical retailers. In the following slide, you will see some of the benefits of using MyVision Express. MyVision Express is available as a web-hosted or in-house server installation. We have a bidirectional tab integration, which means that any appointment made in either tab or MVE calendar will transfer over to the other. The robust marketing module allows you to handle complex promotions, including buy one get one free. Our single-page point of sale is the optician's dream, allowing for an order to be put in quickly and accurately. There are built-in frame and lens validations to help reduce errors and thus customer service issues. The after-sales wizard will walk you through all of the post-sales transactions, including reprocesses, warranties, exchanges, and returns. You will be able to pre-authorize insurance benefits without leaving the program by using the Who's Your Insurance integration. Auto-calculate the insurance due and patient amount due on an order. You can then create the claim and electronically submit. With MyVision Express, you will be able to handle all of your day-to-day workflow. This includes scheduling appointments, inventory control, orders, insurance calculation, submission, and payments, electronic lab submissions, recalls, and reporting. Let's start by reviewing the icons that you see on the main screen. The calendar allows you to schedule your patients for appointments with physicians or resources. The patient profile is the equivalent of your paper chart and is the receptacle for your patient's information. Next, we see the order icon, which will take you to the one-page point of sale. Clicking on the small arrow next to it will show you the checkout icon. Once clicked, it will take you to the checkout, where you will be able to take payment for orders. Underneath is the after-sales icon. Once clicked, you will be able to search for orders for which you would like to return, reprocess, exchange, or warranty. A wizard will walk you through the entire transaction. The delivery icon will allow you to mark an order as delivered in your system. If the order has a patient balance, you will be warned and not allowed to deliver it until the balance is collected. The item detail icon, which also has a small arrow next to it, allows you to quickly search inventory for a particular product. The claim icon will allow you to search for a claim or create a new one. Exam is where you will look for an existing exam or create a new one. The time clock is where your staff can perform time in and time out functions during the workday. This will populate a timesheet and you can run reports to get the necessary info for your payroll. The message icon is an inter-office messaging system. You will be able to send messages back and forth among staff. These messages can be tied into a specific patient, order, exam, or insurance claim number. The tracker allows you and your staff to see what patients are checked in, what services they are there for, who they are going to see, and other useful information. Clicking on the help icon will bring up a text file where you can get additional info about any area of the program. The support icon also has a submenu that you can access. Clicking on any of these icons will take you to the appropriate support. Save will allow you to save changes at various points in the program. The close icon will close the program. Clicking log off will log the current user out and bring the login screen back up so that a different user can log in. Let's open our calendar. The calendar opens to a default 7-day view and displays all physicians. There are a couple of different views that you can use. You can choose a 1-day view. You can choose a month view. We'll go back to the 7-day. You can also group by date. And this will show you your physicians broken down into each day. And you can also group by physician. Clicking on that will show us our physicians with each day within their name. Go back to the standard view. You can also see the calendar for a particular physician instead of all. And if you have multiple locations, you can click here and pick another location. Let's go back to our default. Let's make an appointment for Thomas Edison. We'll double click on the slot and select an existing patient. His information is filled in, as well as any appointment history. We'll say that he's going to see Dr. Franklin, and it will be for an existing patient comprehensive exam. And we will click OK. And here is our appointment. If you use Tab, this appointment will transfer over into your Tab appointment book. And any appointment that you make in your Tab appointment book will also transfer right into your MVE calendar thanks to our bidirectional connection. You can authorize the patient right from MVE. Double click on the appointment, click Modify, and it brings up your patient profile tab. We'll go over to the insurance section. By clicking the Who's Your Insurance button, you will search every insurance for which you are credentialed to see if a patient is covered by a plan which you provide services for. You can then obtain the authorization for that patient. Due to time constraints, I've already pulled an authorization into the system and it shows here. While we have this module open, let's take a look around. The patient profile is comparable to a paper chart. Here you will find all of the information related to your patient. The main page allows you to see a picture of your patient, a current balance, referring physician, up to 3 different addresses, and other pertinent information. The Demographics tab allows you to collect additional information as far as employer, who the guarantor is for his insurance, if he was referred, and any financial methods. The Vision RX tab is where you will find all of the patient's prescriptions, whether they be spectacle or contact lenses. The Files tab is where you will scan in any printed documents that your patient might have signed and upload it and save it into his profile. The History tab gives you a breakdown of the patient's order history, appointment history, exam history, and insurance claim history. The Family tab is where you will be able to link family members to Mr. Edison, and you'll be able to generate family receipts. VSP packing slips, if applicable. The Health tab has numerous sub-tabs that are related to the medical portion of this patient's information, so this will be usually viewed by your physician and his staff. The Customs Field tab allows you to collect more information that you don't find already collected by the software. The Interactions tab has a couple of subsections. You have Messages, Consents, and Interactions. The Interactions is where you'll document any interactions you've had with this patient. Consent forms will keep you current with any consent forms that you require in your practice. The Messages tab will show any messages that have been sent back and forth in reference to this patient. We can now click Close. Will take us back to our appointment. Clicking on the Letters tab will allow us to print out our welcome package and give it to the patient to fill out. Additionally, you can email this package to the patient or fax it. Click OK. Checking in a patient is easily done. Right-click, Status, Checked in. The patient is now checked in. We'll close here and look at our tracker. And here's our patient. The doctor would click the exam button and start the exam. For the purposes of this presentation, we will fast forward to the end of the exam. If you would like more information on the exam portion, please watch the presentation titled EHR for Luxxotica ODs. Click on the coder which will suggest what level you should bill the exam at. I'm going to accept the coder's recommendation. We'll bring in the correct procedure code and the charge. Clicking on the letters icon, you will have access to exam letters. From here, you'll be able to print things out like an exam summary or perhaps a cataract referral letter. Since I'm done with this exam, I'm going to click Save. And we can now close our exam. Mr. Edison has been transitioned to the optical, where he will purchase glasses. Before we see an order, let's see how My Vision Express handles inventory. We'll go to File, Inventory. The first 6 are the ones that you'll be able to set up. They are frames, spectacle lenses, lens treatments, contact lenses, other, and services. Let's take a closer look at spectacle lenses. Let's select the Single Vision Poly Transition Gray, and we'll click the Details button. Here you'll be able to determine what measurements are available or required for this lens. If a measurement is not necessary, let's say the seg height, as this is a single vision lens, you can uncheck it. This will hide that measurement from the quick order. Anything that you set as required, let's say an OC height, would be mandatory. Next tab is Treatments. Here you'll be able to control what type of treatments are available for the lens. Things like certain ARs, certain tints, coatings, etc. The Procedure tab will allow you to price your lens out by procedure code. This can be done for one lens, but more commonly you see it done for a group of lenses, and in fact a lens style. Next, let's look at a progressive lens. We'll select our lens and click Modify. There's numerous parameters that can be entered here. You can enter a max add power. You can also select a default lab for this lens. You can also put in a minimum height. If the minimum height is not met on the order, the user will get a message stating the minimum height is 17. You can even enter a valid prescription range. Again, the treatments and measurements can be controlled here. And as you see, some of them have already been taken away, and some have been made required. And here are the treatments. Since it's a Varilux lens, we're only allowing Crizal coatings on it. And we'll click OK. We're now ready to start Mr. Edison's order. We will click on Order. And this brings up our single page POS. Clicking on the patient will allow us to select our patient. We can then click on the UPC field. If you use a barcode scanner, you'd be able to scan in your barcode at this time and it would populate your frame information. You can also type in the number, or you can click on the ellipsis button. And let's search for the frame. Let's select this one. And we'll click Order. Since this is a drilled rimless frame, you'll notice that the drilled rimless charge has automatically come in. This is something that you can configure to automatically happen in My Vision Express if you charge a drilled rimless fee. Next, we will select our lens. We'll click on the ellipsis button, and I want a single vision polycarbonate transition gray. We'll select it. Next, we can select our anti-glare coating. Crizal Easy. We now have our full order. Notice that since there's Prism in the prescription, we also brought in a Prism charge. If you charge for Prism, you can configure that to automatically populate in MVE as well. We'll select our lab, say they'll be ready in a week. We'll say that it's at the lab. We'll assign a tray number. And we'll say that this optician took the measurements. And we're all set. Next thing we're going to do is go ahead and add the exam to this order. So we'll click on Exam. These are the available exams for him. This was today's exam. We'll select all and click OK. and the exam charges along with the refraction fee comes in. We're now ready to add our insurance. IMED, Advantage, and our authorization. And here we can see that the authorization applied to the order. Here's a breakdown of the patient's copays and what the patient is responsible for. Patient total, then you have your insurance numbers, everything that the insurance is responsible for, and totals at the bottom. You'll click Save. We are now ready to take payment. We'll click the payment button. It's going to ask you about consent forms. There are some consent forms that I have configured in the system that would need to be printed and signed by this patient. I'm going to skip this for now and say no. And here is your checkout. I can now add a payment, and let's say he paid us via MasterCard, and click OK. I now need to go back to my order to create my claim. I'll do so by clicking on the Open. We'll click on the Claim button to create the claim. It auto-populates all the information for you. If there was a referring provider, it would be in here. Here's your diagnosis. Here are your charges. Let's assign a status. And we'll say on hold. There's a breakdown of all of your charges, of course. Your provider information. Here you'll be able to submit electronically or print the image. And here's a preview of that HCFA form. We'll save and close. Let's take a moment to briefly discuss Patient Portal. The MyVision Express Patient Portal is a powerful business management tool designed to save time and increase efficiency. The Patient Portal is available exclusively to MyVision Express Cloud customers. It seamlessly integrates with MyVision Express Cloud software and allows you to provide the best patient care at any time, even when you're out of your office. Your patients can access the Patient Portal directly from your practice's website. All information collected through the Patient Portal is automatically downloaded into MyVision Express and links to each patient's file. Your patients will be able to complete forms online prior to their visit or on tablets in your office. This will significantly reduce the administrative burden on your staff while increasing efficiency. Your patients will also be able to log in and request to schedule, confirm, reschedule, or cancel an appointment. They can also pay their balance right from within their Patient Portal and even reorder contact lenses. Let's take a closer look at this last point. Mr. Darwin has logged into Patient Portal and sees he has a prescription available for contacts. He clicks on this to get his order started and decides he wants one box of each. As he continues, he will go to the confirmation screen where he will review his order and address. He will then pay for his order by entering his credit card information. Patient Portal security uses HTTPS connectivity with 256-bit AES-SSL encryption. Once paid, Mr. Darwin will get a confirmation screen, complete with an order number, and will also receive this info via email. To see how this order has updated in your system, you will go to Quick Order and do a search. It will come up under Order History for the day. It's now a few days later, and Mr. Edison has come back to our office, and we need to dispense his glasses. We can click on the delivery icon and type in his order number and click Deliver. It will ask you, are you sure you want to deliver this order? You will click Yes, and the order was delivered successfully. We can now close. If we open the order up, we'll notice that it's been marked delivered, and the person who was signed in and delivered it. Some time has passed and we have now received a check from IMED for Mr. Edison's claim. You can post either a paper check, which you will have to allocate manually, or an electronic remittance advice, more commonly known as an ERA, which will automatically post for you. All you would need to decide is if to write off or transfer any discrepancies. Let's post a paper check. We'll go to File, Batch, Payments. We'll select IMED as the insurance. You can also search for the order number. Here are all the available orders that have IMED claims. We'll select Mr. Edison's, and the insurance balance is $139.75. We can go ahead and put that in. And since there is nothing left over, there is nothing to write off or transfer. In the event that the insurance pays you, let's say $130, now we have a new insurance balance of $975, which was not paid. We can go ahead and write off the difference, assign the balance to the patient, or to a secondary insurance. We'll just write it off. Go ahead and select the payment method. Let's say we got a check, and the amount $130. Check number, the insurance, and any notes that you want to type in. Once done, you can click Apply. Payments applied successfully. Click OK, and you're done. We can now close. Let's say some time has passed, and Mr. Edison could not adapt to his new glasses. He comes back to see the doctor, and there's now a new prescription, and we need to remake the glasses. We will use the After Sales module. My Vision Express's After Sales module has a wizard that will walk you through the complete transaction. This will ensure accurate inventory, as you will be able to source what to do with the returned items. The resulting order will open with everything filled in and properly calculated. We'll first search for the order and select it. And here's our order. We will do an exchange. Do we need to reorder a frame? No. Do we need to reorder lenses? Yes. We need to order the right and left. We also need to change the RX. We can enter a new spectacle lens RX. And click Fill. And we'll click No. We want to leave the other one as is. Here's the lenses we're including, and we'll click Next. And we'll return the original lenses to manufacturer, and the reason, Physician RX change. Next. And here's your resulting order. It all comes in at no charge because we designated a Physician RX change to be no charge logic. You can configure different reasons to have either no charge logic, or they can be assigned an after sales marketing code that will charge the patient. This will be especially helpful to those practices that charge copays for things like warranties. You will be able to easily configure this in My Vision Express and have it apply to the order automatically just by selecting the reason in the after sales transaction. We can now close this order. The Letters module is a powerful tool that allows you to do many different things. This can range from helping you enforce consent form compliance or sending out happy birthday letters to your patients. Let's take a look at that example. We'll go to File, Letters. Click on the Letters tab and select the patient birthday. Let's look at the letter detail. This is what the letter looks like. These are merge fields that will automatically fill in for you with the patient's information and anything else here. You also have a 20% off coupon. You should have already created a 20% off birthday coupon in your marketing section of My Vision Express. By doing this, you'll be able to go ahead and run reports that will show you how effective this and any other of your marketing campaigns or promotions have been. Go to search and enter a birth date range. Let's say January 1st to January 31st, and we'll click search. And here's our results. We can either print out the letters, or if you have postcards professionally printed and made and all you need are labels, you can click on the labels button. And here are your labels. If this is not the label type that you're using, you can always go into the labels button and in the drop down select the appropriate label name. These 4-digit codes are the codes that you'll see on these labels that you'll purchase at your stationery store. Select the matching one so that you have the proper format. You could print those out and send them off. My Vision Express comes with a robust reporting system that is broken down into several sections. We'll go to File, Reports, and here you see you have Order, Inventory, Insurance, Patients, Exams, and some other reports. Some of the more commonly used order-related reports: the after-sales transactions, to keep track of how often you're doing after-sales transactions and what you're doing with them. You also have a daily closing, detailed order sales, employee commissions, orders by marketing, so that you can run that 20% off and see how effective that was, and numerous other reports. Let's take a quick look at the age receivables report. We can select the date range and click search. And here's my age receivables report. It will show you 0 to 30 days, 30 to 60, 60 to 90, and anything over 90. Another good report is your day sheet. You come in here, select the day, and here's your day sheet. Here are your total sales for the day, what you did by item type, any marketing that was used in these orders, and your net totals. Tax if applicable. Here are your payment breakdowns by method, any write-offs, and here's our insurance write-off that we did earlier, any returns, and all of the rest of your financial information. This will allow you to reconcile your day. If you for some reason missed a payment, you will be able to go ahead and close, go ahead and make that payment, run a new day sheet, and you will have your updated totals. You can of course print, email, or fax this report to anybody that needs to see it. I hope you can see why My Vision Express is quickly becoming the top recommended Luxxotica system. It is easy to use, and you'll have a dedicated implementation specialist to guide you through getting started. Once you're ready to go live, our trainers, which include eye care professionals, will instruct you on the use of the software via live web-based sessions or even on-site training if you choose. You will have access to Support Central with numerous videos and knowledge-based articles that go over the software features step by step. Should you ever need help, our top-notch US-based support team stands ready to assist you. 95% of support calls are resolved on the spot. We love feedback, so if you have an idea as to something that may enhance the software, please let us know. Enhancement requests are routinely incorporated into our updates. We have numerous industry partnerships to help streamline your practice, eliminate double data entry, and reduce errors. On the next screen you will see just a few. Please visit our website for a complete list. This concludes this video presentation. Thank you for watching. Please contact our sales team at 877-882-7455 to schedule a personalized demo. We look forward to helping you accelerate your practice.